It is 6 months since Nigeria recorded the first case of COVID-19. Today, the country has recorded more than 50,000 confirmed cases and over 1,000 deaths. However, the good news is that there have been recoveries, and this has come with misconceptions and stigmatization. Today on the show, that is our focus. I am Olasunbo Mudupe. Welcome to the show. We begin with COVID-19 updates.
The Presidential Task Force on COVID-19 has launched 2 incident and response tracker dashboards. They are the Incidents and Response Tracker Dashboard designed by the Nigerian Economic Summit Group and the COVID-19 Resource Tracker Dashboard developed by the United Nations Development Programme UNDP. The dashboards aim to enhance transparency, accountability, and accessibility of information in the national response to the pandemic. Chairman of the PTF, Mr. Boss Mustafa, said both dashboards are interactive portals for all resource mobilization activities, donations, needs, and disbursements, as well as data-driven response from the onset of the pandemic. All tertiary institutions in Lagos State are to reopen for academic activities from September 14, 2020. Governor Babajide Sanwo-Olu has also directed that primary and secondary schools across the state to resume on September 21, 2020, but said this date could be subjected to further review in the ongoing modeling of the state's response to the pandemic. Sanwo-Olu explained that the decision to reopen the schools was carefully thought through, given the decline in the number of positive cases and the progress recorded in the state's response. He asked the management of the schools to ensure adherence to all safety guidelines as they reopen their campuses for activities. Governor Sanwo-Olu also permitted the reopening of recreational centers and social clubs that had registered trustees, but on the condition that they obtain a provisional safety compliance certificate through the registration portal of the State Safety Commission. The governor also launched a COVID-19 care pack which contains medications, hand sanitizer, face masks, and handy medical equipment that could be used to check temperature. The care pack is to be given to those who have been confirmed positive of the COVID-19 free of charge and who prefer home-based care. There are over 25 million confirmed cases of COVID-19 globally, while in Nigeria, more than 50,000 cases, above 1,000 deaths, and 41,513 recoveries recovered.
It is still Sound Health on Lagos Television. Joining me now via Skype is Dr. Shakirah Gold Olufadi, a dermatologist with the University College Hospital, Ibadan. Dr. Gold Olufadi will share with us a journey as a COVID-19 survivor. Welcome to the show, Doctor.
Thank you, Ms. Olasunbo, for having me.
Okay, how does it feel having recovered from COVID-19?
It feels good. It really feels good because, COVID-19, a lot of people have died because of the infection worldwide. It's a pandemic going on now. And to know that I have not been added to the fatalities, to know that I've not died as a result of the infection, I feel good and I am thankful because of that.
Okay, how did your journey start and what was your reaction when you were confirmed positive?
Okay, it started about 6 weeks ago. So patients come to me in the clinic normally. I work in Oyo State and we have a lot of Yoruba people here. And so they come to me in the clinic saying, doctor, otutu umumi lati nowa. Sometimes I'm like, I don't even understand what you mean by this. But honestly, my infection started with that feeling. I was feeling cold from inside. Otutu ye umumi lati nowa. It started at night, if I remember clearly. And I was just so cold. It wasn't a cold night, and so I needed a lot of blankets around me. I used some analgesics, and after about 20-30 minutes, I was able to sleep. So my mom stays close to me, so I usually go there, just pop in there, have some lunch and dinner sometimes. So on my way from work, I had dinner once, and the food tasted so good. It was amala. So I said, I want a repeat episode of this the next day. By the time I went there the next day, I ate the food, and honestly, it was like I was eating boiled pepper with metallic taste in my mouth. It didn't have anything. And after that, over the next course of days, I started having headaches, poorly responsive to analgesics, headaches, muscle pain, almost like, like a tractor ran over me. I was just feeling so sick. So I went to our lab and I did some tests. After doing those tests, I had results that showed, because I did something we call a full blood count. So it showed that my white cell counts were a bit low and my blood levels were low. And my malaria test was negative. So I went back home, I had some food, just a little bit I could tolerate. And after that, I noticed that I had my bath and I was using my perfume, my body spray, and I could not smell anything. Normally my perfumes come on really strong. So I couldn't smell anything. I went into the kitchen, I tried ginger, garlic, I couldn't smell anything. So I called our infectious disease consultant, Dr. Adekombi. I called our virologist. So they sent home the COVID-19 team and they came to test me. Initially, when I learned I was positive, I was anxious, I was scared, even though I know that a lot of people recover and I'm young, so I expected I was going to recover. But I'm an asthmatic patient, so I was a bit worried. But luckily, I didn't have any respiratory symptoms per se. Initially, I started writing letters. I love to write. I write a lot on social media. So I started writing letters to my loved ones, just in case I don't make it. COVID-19 can make you think in a funny way. So one of my friends, our neurologist, told me that in Yoruba, she said, Ojaye koleta rada rada. You know? So I tore up all the letters and I told myself that, Shaki, you are going to beat this, you know? And after that, by the second week the first week was really bad. I had diarrhea, I had vomiting, I was feeling so sick. I couldn't even stand up from home. All I did was just, go to the bathroom for bathroom breaks, and I was just on the floor. But by the second week, I started to improve. I developed hemorrhoids, what you call piles. But afterwards, all these symptoms started to get better by the second week. Okay. So the recovery process was good. Because I had a lot of people supporting me.
Okay, were you bothered about how you contracted the virus? Did you think about that at all?
You know, as a health worker, the risk is always there. I'm a doctor. So patients will come to the hospital, and you can see from my presentation now that COVID can present with almost anything. So, all the cough, respiratory symptoms, it doesn't have to be that way. So by working in the hospital, I'm exposed to patients already. And even though I practice my hand hygiene, wear my face mask and all that, the risk is still there. And we already know that there's community acquisition of COVID-19 infection. So I tried to trace my source of infection, but unfortunately, I wasn't able to. All my close contacts, my colleagues, my family members, they were all negative, thankfully, because that's one of the fear of health workers. You're always afraid that if I get something, I don't want to take it home to my family. And luckily, all of them were negative. So I wasn't able to trace my source of infection, unfortunately.
Okay. So what was your experience with caregivers and other frontline care workers during this time?
I self-isolated at home, actually. Our infectious disease consultant advised that, and since I was alone in the house, my husband works out of state normally, and so my children were taken care of by my mom and my siblings. My husband didn't come home for about 2 weeks initially, so I was alone at home. But the only thing was that I had my mom coming to drop food for me, and I had the COVID-19 team in form of the consultant, the infectious disease consultant. She taught me, I was checking my oxygen levels, and so if I needed to go in for admission, I would have gone in. But at that point, it was wise for me to self-isolate at home.
Okay.
Although the team was managing me at home, I self-isolated at home, and the team was fantastic. Our virologist, the infectious disease consultant, the Oyo State COVID-19 team, everyone was fantastic. So I had a good experience.
Okay, was it because your viral load was low? That's the more reason you self-isolated, or was it that you just made up your mind that okay, I won't go to the isolation center? Was it a medical advice?
So anytime you are managing a patient, whether it is COVID-19 or any other infection, you assess the patient based on the clinical state. So I didn't have respiratory symptoms. My oxygen saturation was fine. And I had health workers that were managing me. So I didn't need to. And the isolation centers are full already. They are overwhelmed. So it is advised. It's based on the clinical state. And my viral load, it wasn't like it was low.
Okay.
But luckily, perhaps because of my immunity or one thing or the other, I didn't have infections that necessitated, I didn't have a presentation, that necessitated hospital admission. My oxygen levels in particular, it remained normal all throughout the course of the sickness. Not that I wasn't sick, but I didn't need to be admitted. And it's advised to do that. If you are not requiring some in-hospital management, some equipment, some ventilation, you're advised you can self-isolate at home as long as the team is managing you while you're at home.
Okay, don't you think the more reason you didn't go to the isolation center was because you noticed the symptoms early enough? Some people find it's good to take care of yourself at home, to isolate yourself at home, but some people, they don't even notice the symptoms, and at the end of the day they end up at the hospital. It will be too late. Would you still recommend that?
No, there was no way I said that I recommend self-isolation at home. I said it's based on the clinical state of the patient.
Okay.
So normally, I was tested and I was seen by our virologist. I was seen by our infectious disease consultant and our virologist. So even a patient that has COVID-19, if you go to the hospital and you don't require hospital admission and you have a place to self-isolate without contact with anybody,
okay,
you can be asked to do that.
Okay.
The hospital is full. The infection it keeps increasing, and it's an emerging infection. So
Okay.
you can't overwhelm the isolation centers when you have patients that actually require ventilatory support, that require oxygen management while in the hospital. So it is based on the clinical state of the patient. I would admit that because I'm a doctor, it was easy for me to think of COVID-19. Immediately, I lost my sense of smell. But I would not advise anybody to just take that decision on their own. It's not something you can take on your own.
Okay? Thank you so
much. And even as a doctor, I did not manage myself. I was managed by a team when I was sick.
Okay, thank you so much for the clarification. Okay, Dr. Gold Olufadi now. Some survivors have said the treatment process is not as complicated as being portrayed. What is your view?
It's okay. Yoruba people say anybody, lole ifenue, so anything, So it's okay. You can say, the mouth is there. You can say anything you like. But unfortunately, it doesn't work that way. And it's quite sad that if public figures coming out to say this kind of thing, because that's tantamount to trivializing the issue. We all know that there are several drugs that have been tried. I can mention the names of the drugs because people are reading. It's all out there online. Hydroxychloroquine is one of them. And contrary to what people think, hydroxychloroquine is actually not a drug we use for primary treatment of malaria. In the hospital, hydroxychloroquine is a drug I use regularly for my patients that have connective tissue diseases. Because of the fact that people are panic buying hydroxychloroquine, they are hoarding the drugs. It's not even available for the primary reason that we need it for anymore. It's that hydroxychloroquine used to go for about 10, 12,000. It's about 48,000 now. Our patients that need the drugs for the regular conditions like lupus, they can't afford the drugs anymore, or it's not even available. So you can't trivialize the issue. 100% mortality in one family is 100% for that family. So because you recovered does not mean you should go out and say that the treatment is not as complicated. There are several things still under trial. Anti-malarial drug, chloroquine, mycin, and several other things. But you can't trivialize the treatment because you recovered. The truth is actually that a lot of people will recover from the infection. But whoever dies or whoever has a severe infection is not going to share this kind of sentiments that people are bringing out there. So what we are saying is that we want to flatten the curve. We don't want people to just go out there saying different things all around. Okay. So it's wrong to trivialize the issue and say, and by the way, malaria is a serious infection. It's just because Nigeria is a hyper-endemic region. That's why we just call malaria.
We see it as normal.
If you go abroad and you mention malaria, people run away from you.
True. How has life been since that phase? What has been people's response after this phase with you? Especially family, friends, and colleagues.
It has been good, honestly. My social support is very, very large. Both offline, online. I have my family, my friends, online and offline, my colleagues at work. People have been really nice to me. And I think that one of the reasons why people talk about stigmatization for any kind of disease is because you allow them to stigmatize you. And a lot of people even self-stigmatize. You know, I'm sure that some people have a problem with me talking about it. But for me, I didn't want to talk about it. I have a website, I have a blog. And so that was where I put the post. I didn't want to talk about it initially. But my husband and one of my friends, that she also writes, she told me that I think you should write about it. It will help people because you are coming from a perspective of a health worker. And you're also coming from somebody that can write, people find you relatable. So I think for stigmatization, people self-stigmatize themselves already. You can't stigmatize somebody that does not even allow you to stigmatize him. So I won't even allow anyone to stigmatize me. So if you stigmatize me, I also ignore you. But thankfully, nobody has done that to me. Okay. I have a lot of support everywhere, and I've been fine, thankfully.
Okay, so that brings me to my next question. It's good that you've not been stigmatized. How have you been able to undo contact tracing, the procedure after treatment?
So the contact tracing was done. The contact tracing was done, like I told you. So the COVID-19 team, they tried to, they went to a list of my close contacts. They did a contact tracing on them. And unfortunately, they were not able to discover the source of my own infection. But at least my colleagues, my close colleagues, my family, all my family members, down to my little baby, I have a 3-year-old son. Everybody, they were all screened. Okay, so and they didn't discover the source of infection, but luckily everyone around me, they were negative. So, and again, the Oyo State COVID-19 team, they were calling me every 3 days while on isolation, and every week after that for all the period I spent self-isolation.
Okay, that's good. After the treatment process, was your apartment disinfected according to the cleaning protocol? Because we hear that, okay, according to the World Health Organization's cleaning or disinfection guidelines, you're supposed to disinfect a facility. Was that done in your case?
Yes, it was. Yes, it was. Definitely. I'm a health worker, so all these things are, even I don't want to, and you know, contrary to what people think, they think that you can have a reinfection from COVID-19. Personally, I have 3 people that I know that have been reinfected. After my write-up, a lot of people sent me their stories. In fact, I'm planning to probably write a series on that on my website. People that couldn't talk before. They sent me their stories. I have people that lost spouses to COVID-19 that sent me their stories. So my apartment I don't even want to get the infection again. It's not something I want to get again. So it was disinfected according to the protocol.
I was going to ask you, are you afraid you might get infected again, considering the nature of your job and all that?
Of course I am. I don't want to get it again. I'm more careful now. I practice my hand hygiene regularly, the physical distancing, use of my sanitizers, and I'm back to work already. So, you know, I'm seeing patients already. I'm doing ward rounds. I still get tired. I'm doing ward rounds for a long time, but I'm back to work and I'm being as careful as possible because I have personal cases of people that I know that are infected a second time. I don't want to get it again.
True. As a key player, what is your assessment of efforts in flattening the curve in Nigeria?
Okay, so part of it is what I'm doing already. I'm writing about it. I'm talking about it. You are doing an interview about it. You know, so a lot of people have called me Just yesterday, someone called me. Someone sent me a message on Twitter telling me that I'm worried I might have COVID-19. I've directed him to where to go. So I'm doing my best to make. I think one of the most important things is education. You continue to educate, re-education. You continue to do all that, and so that's what I keep doing.
Okay.
And so I think I'm contributing my quota to that by educating, by talking about it, by telling people to stop the stigmatization, and by coming out to talk about my story. So, and I don't think my story is special. A lot of health workers have gotten it. A lot of people. The only reason why people know about mine is that I decided to talk about it. So maybe this will make more people talk about it. And I was in a lorry a few days ago, just yesterday. I wanted to ask someone a question through my face mask. And I'm from Ilorin. The guy answered me, hey, you're into what? So people still don't believe. So at every point, I try to educate people. And, you can only do so much. You keep talking, you keep educating. And that's all you can keep doing for now.
Okay, what message do you have for people who still doubt? What message do you have for people who still doubt COVID-19 is real? As we wrap up this segment.
The message I have for them:
Yes.
a trial will convince you. So if you keep saying that COVID-19 is not real, honestly, that's the only thing that can convince them. And I hope that trial would not lead them to be one of the case fatalities, contributing to the mortality of the disease. So it is, I think it is, you may believe that COVID-19, most people will recover, but to say that it is not real, I think that has been like you are living under a rock, okay? And the thing is, I see a lot of people, Nigerians, we have that syndrome, the syndrome of, do you know who I am? COVID-19 does not know who you are. It doesn't. So the most important thing is that, I've been there before. The security personnel was telling the person, sir, can you wear your face mask? Why will you ask me to wear my face mask? It's unfair. You can't do that to security personnel. They are asking you to do the right thing. So please, do the right thing. Even if you don't believe it is real, please don't let people suffer from your collective ignorance. Do the right thing. Wear your face mask. Because this disease is one that a lot of people will suffer from the ignorance and from the carelessness of other people. So you should do the right thing even if you don't believe it is real, please wear your face mask. Stay in your house if you don't have to go out. Don't go and organize Owambe at this time. And do the right thing. Just that's all we ask of you. And stop harassing security personnel when they tell you to do the right thing. Use your hand sanitizers, wash your hands, and just do the proper thing so that this curve can continue to be frozen.
Do the right thing. Adhere strictly to precautionary measures to beat COVID-19. Thank you so much, Dr. Shakirah Gold Olufadi, for your time. We really value your experience.
Thank you for having me, Ms. Olasumbo. I'm glad I could contribute.
Okay, well, I have been talking to Dr. Shakirah Gold Olufadi, a dermatologist who conquered COVID-19. I'm sure our experience has dispelled some myths and misconceptions about the virus. Sound Health continues with trending health news. Please stay tuned. It is still Sound Health on Lagos Television. Stigmatization of persons who have been diagnosed with COVID-19 can discourage those who have been exposed from getting tested. Let's stop stigmatization associated with COVID-19. Stay safe and observe all precautionary measures against COVID-19. That is it on Sound Health this week. For comments and inquiries, please send SMS to 08035 826603 or follow us on social media at LTV Social. Hashtag Sound Health. A sound health is a sound mind. Make healthy living your choice.